Academics are calling on the government to come up with a different strategy to address backlogs with COVID-19 testing. They say officials must eliminate unnecessary and wasteful testing countrywide. For more on this, we're joined by Wits University's Professor of Medicine, Francois Venter. Francois, good evening, and thank you so much for your time on News at Prime tonight. Now, it's interesting because the conversations we've been having with different officials on the issue of testing in the Western Cape and in the Eastern Cape is that they're now prioritizing those who are in hospitals, those that are high risk, over 50 with underlying diseases, to be the first ones who can actually be tested for COVID-19. Is that strategy effective?
I don't think it's aggressive enough, actually. I think at this stage we are in such a crisis around testing that we have to prioritize only the hospitals and the healthcare workers. We have all the laboratories overrun with testing from communities, from idiotic decisions from various ministers, including the sports minister and the labour minister, that are pushing testing into groups that don't make any sense whatsoever. It's the entire reason the lockdown was implemented was to protect our healthcare facilities, and particularly our hospitals. They are in danger of being overrun. And what's happening at the moment is tests are being done on people who are completely healthy. It's a complete waste of time. When there are people inside the hospital, ill people who need that diagnosis as quickly as possible, and healthcare workers who need to be able to be told, can they safely come back to work? That's where we should be prioritizing at this point.
Let's speak about the decisions by the ministers. You've referenced the ministers of sport and labour in particular, which you say that are completely unnecessary. Expand on that.
They're not unnecessary, they're absurd. This test is not a great test, particularly if you're asymptomatic for the virus. It comes back negative often when you actually have the virus. So you pretty much need to be testing everyone every single day to be absolutely certain, or not even then, you still won't be absolutely certain. You'd be 60–70% certain that they don't have the virus. It's not a good use of the test in asymptomatic people. Across the world, they've stopped doing that. We have to prioritize the hospitals. And then we start doing other things, like we prioritize old age homes where people are getting sick, or where people are presenting in outpatients where they're ill. But there needs to be a pyramid here. It's like having an ambulance where somebody's dropped a brick on their toe, and on the other hand, you've got a woman bleeding to death during pregnancy. You choose the woman who's bleeding to death. It's an easy choice in terms of priority setting. At the moment, we're harming everybody. We're getting no benefit from the testing program that's being implemented.
Now, many South Africans, of course, are quite anxious about COVID-19. Many would want to go testing and know that they are negative, so that they are then able to fully adhere to quarantine measures. Do you think that people who suspect that they might have COVID-19 should immediately then be going into quarantine anyway, whether or not they go for the test?
Yes, that is the recommendation. And if people are suspicious that they've got and they can't get a test, that is what the recommendation is. What's happening at the moment, though, is we testing people with sore throats when somebody in ICU can't get the diagnosis to the door because the test is just queued up in a way that doesn't make sense. So in a perfect world where we had unlimited resources, that it would be great to be able to test people who are symptomatic and say, we can tell you with a fair amount of certainty, we can tell you if it comes back positive, you're definitely positive. If it's negative, we can say, listen, you probably don't have it, but we can't be certain. You might need to test again. But we are not in that position at the moment. We are fighting for tests with every other country in the world. And there are sometimes tests, there are sometimes not tests. What we are seeing at the moment is a very aggressive testing program in the absence of having those resources in place. We need to shut the testing program down tomorrow and prioritize our hospitals.
The implications for that, of course, are vast, because on some levels it means that the tracking of COVID-19 then almost goes completely off the radar. Well, maybe not completely, but relatively off the radar, because you'll have many people in the community who have it, who don't know they have it, and are potentially spreading it too. Does it mean that we then get to a point where it doesn't matter what the numbers look like? We are just concerned with those that are hospitalized and could effectively lose their lives?
So it's not an either-or situation. We have other tests that we can do to see what's happening, and the hospitalizations are a good proxy for where there are hotspots. So in the absence of having a test that we can use, we do have other ways of watching the data, and we've been quite good about that. The NICD people are amazing at collating the data, intelligently interpreting it, and trying to use it. So it's not as if it's an either-or situation. However, you do not prioritize observational stuff, looking at trying to work out what your epidemic's doing, when your hospitals are bursting at the seams, waiting for the patients to be de-quarantined. There's an intelligent way to ration these tests that allows us, on the one hand, to protect our facilities, at the other way, to also to track intelligently how we need to be responding to the epidemic. It's not an either-or situation.
There are, of course, concerns about those who may not get access to medical attention in time for a diagnosis, and therefore they could very well lose their lives without knowing that they were COVID positive.
Absolutely. You're going to be, at the moment, we've got people sitting at the hospital, sick as dogs in the bed, because we can't tell them if they've got COVID or if they've got pneumonia, if they've got a whole range of other illnesses. So this is a critical part of us making the diagnosis at the hospital level. The hospitals have to be prioritized. So if you're really ill and you pitch up at the hospital, we can test you and confidently start applying it. What's also happening is we're getting a whole of other diseases getting through the door where we think it's COVID and it's something else. So the testing, it has to be prioritized at the sickest people at this point.
Sure.
And then we also, yeah.
Of course, one of the things that could happen then is that you'd have people choosing to go to the hospital for their testing because they know that that's where they're most likely to get the test. So doesn't it mean that on some level you could just have a diversion of that traffic?
You might. At this point, it's better than what we've got at the moment, which is tens of thousands of tests being directed to the laboratory every day, which are just sitting, which are being processed very, very late and not doing anything at all. I think that people, if they're really that desperate to get to a test, will do silly things like that. So then I would hope that there'd be enough social responsibility for people to maybe think twice. But, people at the front line, the healthcare workers, they know what this looks like. You know what a sick person looks like. So if you get somebody there with a mildly snotty nose coming through to casualty, firstly, they're putting themselves in a lot of danger in terms of being exposed to COVID themselves. But also, the healthcare workers can take one look at you and say, you really don't need to be hospitalized. It's not that difficult to make that call. If you're short of breath, if you're looking really sick, you're probably going to get that test anyway.
So let's then speak about the risks that come with a strategy such as this. So we limit the testing to the hospitals, and you have people that are going to their local clinics or whichever health facilities that they're able to access to get their tests. Now, if these people are COVID positive, then it obviously automatically means that they then are spreading it spreading it to whoever else that they interact with. How do you manage that? Especially because then what it means is that people might take it less seriously, might take getting the test and knowing that you're COVID positive less seriously.
So it is difficult. What we have advised, and it's an international advisory, is if you're sick, socially isolate. We've been saying if somebody's sick at work, it's incredibly reckless for that person to remain at work. If they're within the family environment or if they're in an institution of any form, they need to try and isolate as best as they can. And they're clear guidelines, in terms of the social distancing. I think everyone's pretty sick of hearing them over and over again. But using masks, the social distancing, you can make yourself safe. It's very difficult in an informal settlement, sure, in a shack. But for many people, trying to just keep themselves away from the rest of the family, trying to ensure that they don't go to work, that they don't use public transport, is the socially responsible thing to do. So it's not as if we're helpless without the test. The test, in some ways, is a false reassurance, because if it comes back negative, that doesn't mean you're not infectious. It just might mean you're very early on, or that you didn't take the swab properly, or that the swab's been sitting in the lab for a week degrading. But
part of what a positive test also does is that it gives somebody, at least those who are employed, more of an opportunity to be able to go to their employers and stay away from work, because there are instances where employees are forced to go to work even though they're saying that I'm not feeling well, I'm experiencing some of these symptoms, and it seems to be either the doctor's note or positive test that ultimately means they're able to stay away from work for whatever time is needed.
It's grossly irresponsible. I think that people who are ill need to isolate themselves, do the best they can to protect their communities. Most people are going to be fine. The people who are not going to be fine is your elderly granny and your grandfather. It's going to be the person with diabetes, the person with cancer. It's the most vulnerable people in our society. So when doctors send people back prematurely, when employers insist on people putting other people's lives at risk, those are the people who are going to suffer. People who are healthy generally struggle with disease. Children seem to be very, very good at struggling with the disease. The people who are not are the people you're putting. When you wear a mask, you're protecting others. You're not protecting yourself so much, which is why we're pushing this so hard. It's about a social contract that we're all undergoing at this stage, which is to say protect the vulnerable within our society.
All right, let's leave it there for tonight. Wits University's Professor